Let me say that in the fall of 2019, I mean, literally weeks before the pandemic hit, when I asked you what kept you up at night.
Obviously, the evolution of a pandemic like respiratory infection, likely influenza.
How close are we to having lived through your worst nightmare?
I think we are living through much of that worst nightmare. I had said when asked in more detail, I remember multiple times responding, a respiratory illness that jumps species from an animal host, that has a high degree of efficiency in transmitting from person to person, and has the high degree of morbidity and mortality either on the general population or in certain groups of people. And in this case, we know we're at that landmark right now of 500,000 deaths, which is historic and horrible in its proportion. I mean, people are going to be talking about what we've been through over the last year and decades to come in the similar manner that we would often reference the 1918 pandemic flu.
We appear right now to be in a race between vaccinations and virus variants. And even as case rates are plummeting right now, health officials are getting increasingly alarmed that variants could lead to another surge even in the coming weeks. What's your best sense right now of whether we are winning that race?
You know, we are in a race for sure. The thing that's encouraging is the sharp slope of the downward trajectory of not only the daily cases, but the weekly averages. As you said, I think appropriately, we know that we have a variant that is now taking hold in the United States that has already shown in the UK that it has an enhanced capability compared to the wild type virus of transmitting from person to person, and likely also is a bit more virulent. That virus, if you do modeling, tells us that it will be dominant in this country probably by the end of March. So a race, if you want to call it, between a dominant virus that is clearly sensitive to the vaccine that we're using, but has a very strong capability of spreading and transmitting from person to person. So we have two major tools in our arsenal. One is a vaccine, which as the weeks and the months go by, we get more and more available to put in people's arms. We have a significant discrepancy between supply and demand. If we had all the vaccine that we would need right now and did mass vaccinations, I believe our chances of winning this war, metaphorically, between the virus and ourselves, we would have a distinct advantage. But we have two tools, one of which is immediately available to us, and that is everybody doing the kinds of public health measures that we've been talking about constantly: the universal wearing of masks, the avoiding close contact, the avoiding congregate settings, particularly indoors, the washing of hands. If we did that in a very assiduous way, that everyone pulls together, even without a vaccine, you could be a pretty good defense against the spread. Superimpose upon that the fact that as every week goes by, we get more and more people vaccinated. That is, as you said, it's a work in progress. I mean, a dynamic situation between what we're doing to halt the virus and the virus's capability of continuing to spread. It is conceivable that if we fall short, that we will have a surge, an additional surge. It's also conceivable if we do this correctly and everyone pulls together, everyone in the country, I mean, all regions, all states do it together, that we could suppress this to a very, very low level. And once you get the dynamics of the outbreak to a very, very low level, even when you get additional surges, it becomes much more effective to be able to identify, isolate, contact, trace.
I mean, how does this movie end in your view? Is this something that becomes endemic? Is it probable that we have annual boosters? What does it look like after everyone is vaccinated in the country?
To be honest with you, Ian, we don't know. We can't be certain. If we nail this down in the sense of getting the overwhelming proportion of the population vaccinated and we get herd immunity within our country, things could change dramatically, at least for the time being in our country. The wild card in all of this is that if we don't control it at the global level, there's always the danger of outside world where there's a lot more virus if we don't get the world and the global response, that we can get variants that could come back into the country and regenerate outbreaks, which gets to what your question is. Are we going to have a cyclic problem here that every year we got to worry about variants coming in from other country? The answer is, I don't know. But I believe the more aggressive we are in vaccinating ourselves, in contributing to the global effort to suppress this globally, not only within our own country, the adherence to public health measures that are so important, it is possible that we could eliminate it as we did with measles in this country and eradicate it as we did with smallpox. That's conceivable, but we've got to put a lot of effort into that.
And I know this has been a horrible year to live through, but on the back of it, do you think we are better prepared for the next pandemic when it comes as a consequence?
Well, we have seen the things that we have got to do. We've seen what doesn't work. We've seen the importance of cooperation and collaboration at the state and federal level, the importance of local public health systems, the importance of transparency. Importantly, the one thing that was and is a resounding success in this terrible years that we've been through is the biomedical research enterprise, which gave us in record time vaccines that are not only safe, but they're highly efficacious. Could you imagine what things would be like if we did not have a vaccine? There would not be a light at the end of the tunnel right now. And right now there is, if we go at it, get people vaccinated, and abide by public health measures.